My name is Sanjay Gupta. I'm a cardiologist, and today's video is entitled, Can you cure a disease by moving continent? So can you cure a disease simply by continent hopping, moving from one continent to another? Sounds ridiculous, right? And yet, if we look at how we diagnose high blood pressure around the world, that's exactly what seems to happen. In the United States, the official blood pressure guidelines define hypertension as anything over 130/80. Cross the Atlantic to Europe, and you're not considered hypertensive until you hit 140/90. Same person, same arm, same blood pressure reading. But in one country, you have a disease, and in the other, you're perfectly healthy. Think about it. If you live in New York with a blood pressure of 135/85, you're a patient. You might be told you need medication, lifestyle changes, follow-ups, maybe even insurance implications. But hop on a plane to Paris and voila, you're cured. Not because your blood pressure changed, but because the definition did. The bigger point is this. This isn't just about blood pressure. It's about how arbitrary some medical thresholds can be. Guidelines are based on expert opinion, interpretation of data, and sometimes a dash of politics and economics. They're meant to guide us, but when they differ this much, you have to ask, are we treating the patient or are we treating the guideline? Why does this matter? Lowering the threshold means more people are labeled as having a disease. That can lead to earlier intervention, which might help some, but it also means more anxiety, more prescriptions, more side effects, and more cost. Raising the threshold might reduce overdiagnosis, but risks missing people who could benefit from early treatment. Neither approach is perfect, but calling one group sick and the other healthy just because of a border, that is absurd. So can you cure a condition by moving continent? On paper, yes. In reality, of course not. Which is why we have to remember, numbers matter, but context matters more. Medicine isn't just about what the guidelines say, it's about the person in front of you, wherever they happen to live.